Hey everyone, my name is Sienna Boyd and we are back in the Choose Health studio. This time we are with Dr. Rahman, who is one of our physicians at our McKenna location. And today we are going to be going over all things diabetes. We will be going through the most frequently asked questions, just learning more about it. Dr. Rahman is somewhat of a diabetes guru within our practice, so I would love to just hear, first of all, if you could just tell us about diabetes, the general knowledge of it.
Yeah, so diabetes, it's a complex chronic disease that it can cause a lot of complications in our diabetic patients, and it can cause a lot of kidney problems, strokes, and all that. So it's really important for patients who have either type 1 or type 2 diabetes to really get good care. And fortunately, with newer medications that are out there, they can really prevent a lot of these complications. And a lot of the patients don't really know what type 1 or what diabetes is in general. And what diabetes is their bodies are unable to metabolize the sugars and the carbohydrates that they eat for energy. And it could be due to many reasons.
Okay. So tell us some of those reasons that you talked about as far as why someone would not be able to metabolize those sugars or carbs.
Sure. So just to make sure that our patients know, we mainly classify diabetes in two categories.
Okay.
So we have our type 1 diabetics who don't have any insulin at all. And in those patients, they really need insulin in order for them to metabolize their blood sugars and to effectively do well clinically. And for type 2 diabetes, this is the second classification. This is 90% of our patients who have diabetes have type 2 diabetes.
Type 2, okay.
And type 2 diabetes, it's kind of multifactorial. One of the main reasons that we see type 2 diabetics in our offices today is because a lot of our patients are overweight, they're obese, they have a lot of inactivity, especially now with COVID season. Everybody's staying at home and they're not really exercising and they're gaining weight. Therefore, either if they do have diabetes, it's becoming more uncontrolled, and if they were pre-diabetic, they're kind of going into that type 2 diabetes.
Okay, and so you said that if you were talking about people who have type 2 diabetes, and you were talking about it being even more controlled or uncontrolled. So tell us the differences between type 1 and type 2 and how you would even control them.
Yeah, so for type 1 diabetes, it's really important to treat our patients, and because type 1 diabetics are going to need insulin. So they're going to need insulin, but we need to manage them in a way that's really similar to a physiological replacement of insulin.
Okay.
So that means they're going to need a long-acting insulin and a short-acting insulin.
Okay.
In addition to that, they really need to be mindful, of course, of their diet, their sugar intake, and to also maintain a consistent carbohydrate diet.
Consistent carbohydrate diet, what does that look like?
So consistent carbohydrate diet means that our patients need to be especially when they're on insulin, they need to have the same amount of carbs, say for breakfast, lunch, and dinner.
Okay.
Because if they eat less, they're more likely to develop low blood sugar events.
Okay.
And we do have some type 1 diabetics. We do teach them in our clinic how to do carb counting and the amounts of carbs that they take in. We teach them and educate them on how much insulin to take for that meal.
Wow.
Yeah.
So it's a lot of education that goes into basically maintaining your body as a type 1 diabetic.
Absolutely.
Okay.
Yeah.
So what does the lifestyle look like for somebody who is a type 1 diabetic? Is it a change in lifestyle, a big change? Is it something that is easily mitigated?
Yeah. So with type 1 diabetes, again, it can occur anytime in their age group. A lot of the times they're diagnosed early on in childhood. But we've had a lot who are diagnosed like in mid-teens or even young adults.
Wow. Okay.
And then for them, the majority of them, they're not really overweight or anything. It's just that their body is not making enough insulin because their beta cells in their pancreas has been completely destroyed by most likely an autoimmune process.
Okay. So would diabetes maybe be considered an autoimmune issue? at some
For
point?
type 1.
For type 1?
Yes. Type 2,
Wow.
again, it's multifactorial. The genes play a role in it.
Okay.
But the majority of the time, it's the environment. It's what our patients, in terms of their physical inactivity,
Sure.
their weight gain, whether or not they're considered overweight or obese, those are more of, they're bigger factors in developing
Okay.
type 2.
Type 2. Okay, so type 1 is more of like an autoimmune issue. It can be diagnosed throughout your lifetime, usually earlier. That's what I'm hearing. Type 2, is that something that you develop over time more as you get older?
Absolutely.
Okay.
Yeah. So more and more patients, like especially with age, as we age, yes, we're more prone to getting diabetes and many other chronic diseases.
Sure.
Yeah.
Interesting.
And sometimes the risk factors of diabetes, I'd like to go over those because I get a lot of patients that I see in clinic that come in for physical exams, and some of the risk factors that I look for patients who may get type 2 diabetes are considered age, as we talked about. So as they get older, anybody over the age of 45, we do need to screen them for diabetes.
Oh, okay.
Any woman who had gestational diabetes is also at risk of getting type 2 diabetes.
Is that when a woman had diabetes when she was pregnant?
That is absolutely
okay.
right, yeah. And some of the other factors include, of course, the main thing is obesity, overweight, or maybe a patient who's taking chronic steroids for some reason.
Wow, okay.
So chronic steroid use can predispose a patient to getting type 2 diabetes.
Wow, so it's interesting that a drug that is meant to help another condition can also then cause diabetes. That's so difficult.
And I also see a lot of patients with mental health issues, and they're sometimes prescribed antipsychotic medication, and some of the antipsychotic medications can also predispose a patient to weight gain. Therefore, they're predisposed to getting type 2 diabetes. So some of those patients, we definitely need to take a look at and screen them and make sure that they don't develop type 2 diabetes.
Is it pretty common when someone gets older and they are more on the overweight side or on the obese side, is it pretty much common knowledge that everybody who is obese or overweight would have type 2 diabetes, or no, that's not necessarily the case?
They are at risk,
Okay.
but it's not necessarily. I have patients who are, in the 200s, 230s, 240s, and their A1C is 5.5. Genetics plays a big role. Activity
really?
plays a big role.
Okay.
But again, that obesity, again, is a risk factor. So they may not develop it right now, but down the line, if nothing is done in terms of losing weight or taking care of themselves, they can get type 2 diabetes. It's just waiting to happen.
Man, so really wanting to take care of yourself and eating a good and healthy balanced diet. So you had mentioned that diabetes is also or might be a genetic risk factor. Can you speak more to that?
Yes, absolutely. So diabetes a lot of patients can be genetically predisposed to getting both type 1 and type 2 diabetes.
Can you have both at the same time?
You mean
type 1 and type 2, or no? It's
it's one or
Okay.
the other. Yeah, one or the other. So for type 2 diabetes, they can have a genetic predisposition.
Okay.
But usually these, if they have a genetic predisposition, what goes into when your body if you're genetically predisposed and you're obese, you definitely will go down the route of getting type 2 diabetes.
Okay.
But if you're genetically predisposed and you're pretty mindful about your diet, your lifestyle, and knowing that you have this predisposition, if you take care of what you eat, you're most likely going to prevent getting type 2 diabetes.
You had said if you take care of what you eat. So going deep into that rabbit hole, I know that's a huge factor in mitigating diabetes. Can you talk to the diet health portion of that?
Yeah, so diet is a big factor.
Like 90%? Is that what we're talking?
More than 90%.
99%, okay.
More than 90%.
Yes.
I was going to say 99. More than 90%.
Okay.
And the reason for that is because our society, what we're teaching our kids what to eat, and just they just have a very poor diet. Everybody's eating a lot of carbs and sugars, and we know that carbohydrates and sugars cause inflammation. And if you're eating carbs and sugars, your body's producing insulin, a lot, more insulin. And that insulin, what it usually does is it helps store fat. So people are gaining weight. So I get a lot of patients, how do I lose weight? Well, you need to stop eating carbohydrates and sugars, because if you are eating more than usual or more than what your body is using or metabolizing, everything that you're eating in terms of carbohydrates and sugars is going to be stored as fat.
Okay.
And then that fat over time causes inflammation and a lot of inflammatory issues to go on in your body, not just in your pancreas, but throughout your body, in your joints, in your vessels and your pancreas. And that's what sometimes leads to insulin resistance in patients who get type 2 diabetes.
So it's not necessarily just calories in, calories out to maintain a healthy weight. What I'm hearing is you also have to restrict or maintain a healthy carb intake.
Exactly. Healthy carb intake, and making sure you're eating more plant-based, and then protein, but having a minimal amount of carbohydrates. What I usually recommend is less than 60 grams of carbs a day for our diabetic patients. If they can go to below 40 or 30, that would be even more optimal.
Wow. Yeah. So really protein-rich breakfasts, like scrambled eggs, and then for lunch, having a nice chicken salad, and then dinner, salmon and asparagus.
That sounds
something like that.
Yeah,
that sounds like the perfect diet.
That sounds very healthy, actually.
Okay.
Yeah, that sounds really healthy.
So do you usually just coach people, your patients who have diabetes, on what to eat, what would be best for them, and then go from there?
One of the things that I do is most patients don't know, much about nutrition. And so I spend a lot of time explaining why they shouldn't eat sugar or carbohydrates, because most of them don't know how that is metabolized in our system, and they don't know that it can make their diabetes worse. In addition to other chronic diseases that they may have, it can make it worse as well.
Well, it's interesting because growing up, I've heard of diabetes. My grandpa had diabetes, so I'm definitely in that genetic risk category. But I remember my grandpa, all he really knew was, okay, I have diabetes type 2. I just won't eat chocolate. I just will stay away from cookies. But he still had pasta. He would still have bread. He was still eating burritos and tacos, and which, but it's interesting because, we're not really educated that carbohydrates and sugars aren't just cookies and cakes, but it's also those pastas, those breads, those refined sugars that our body really can't process well.
Exactly.
I've heard the term pre-diabetes?
Pre-diabetes.
Pre-diabetes. I've heard the term pre-diabetes thrown around a lot. What does that mean?
Okay, so pre-diabetes is a condition where a patient has elevated blood sugars, but they're not high enough for them. They're not high enough for us to say you have type 2 diabetes. And having pre-diabetes, we call it a kind of a chronic disease, because we want to wake up our patients and tell them, listen, your blood sugars are elevated. Most likely, this is going to lead to type 2 diabetes. So we work on the lifestyle, because we know with pre-diabetes, most of our patients are pre-diabetic because of their obesity again, and we work with our patients to help them lose weight and help reverse that pre-diabetes so it doesn't become type 2.
So if they were to stay on the same lifestyle path that they were on, being a pre-diabetic, that would then lead them down the path to develop type 2 diabetes. Okay, and so then we want to work on the lifestyle. So aside from diet and maintaining a low-carb diet, what other lifestyle changes would you encourage somebody who is pre-diabetic?
So mainly lifestyle. I would talk to them about their diet, mainly weight loss, because in the major randomized controlled studies, the only way it's actually worked better than metformin on some patients who are pre-diabetic is actually losing about 7 to 10% of your body weight. Wow. So if you're able to lose that amount of weight, you're more likely to reverse the process and maintain and kind of decrease your chances of getting that type 2 diabetes down the line.
So you had talked about people who then are overweight. who are pre-diabetic and then they become and have type 2 diabetes, that they need to lose weight. So that's what you had just let us know. How do you recommend your patients then go about that weight loss journey? Is it that low carb? What else would you recommend for them?
So weight loss is a huge challenge for all of our patients. So I just saw a lady this morning and she's like, I've tried everything. I can't lose weight. I've been walking. And I feel with our patients because unfortunately, even though she's walking and she's eating, you know, the diet, like a better diet, like cutting down on the carbs, she still can't lose weight. And, you know, we talked about, the main thing I tell them is to motivate them because they could do more. So this is what our patients are doing. They'll exercise for a half hour a day and then they'll come home and not move at all. They'll watch TV. So that's the problem. So when we say increase your physical activity, that means you need to be physically active throughout the day. And then in addition to that, you need to be exercising, you know, on the side. It's not just exercising and coming back home and sitting down watching TV. So that's the problem with the majority of the patients are not really active. They just want to sit down and kind of do what they need to do. They're really inactive. They get in the car, they go shopping, they do they try to park they try to park in the closest parking lot to their mall or their grocery store. And then when they get home, they're not really moving again. And they're eating and they're not burning what they're eating. That's basically it. So it's inactivity. So they really need to be more active during their day, not just, you know, exercising or walking for that half hour a day. And they also, you know, I think Dr. Madrid may have mentioned this, the intermittent fasting. They need whatever food that you're eating, you need to give time for your body to burn it down. So, you know, what I recommend for those patients that have a hard time losing weight is to do the intermittent fasting with a low carbohydrate diet. And that tends to, the majority of the patients that I counsel them on this diet, they go home, they start doing it, and they get a lot of results, good results. So they start to lose weight.
And that sounds like it's something that is sustainable, is that you're able to have your eating window within a certain amount of hours, so from 12 in the afternoon to 6 o'clock at night.
And it makes a lot of sense because you're allowing your body to tap into that, you know, fat reservoir that you have, those fat cells, and those fat cells are going to start to, you know, break down into energy if you do the intermittent fasting. And I explain this to my patients every time they come in. So once they understand now this makes sense, you know, so a lot of counseling.
Gosh, I think it's hard because really, like you said, we're not taught or told how to really eat or how to live our lives and how to have a best lifestyle. But it's been wonderful meeting with doctors and seeing, okay, how can we then educate our patients and then educate our children to then just have a healthier life or healthier world, healthier kids in general.
Absolutely.
I just think that's awesome. Well, if you guys are interested, we also have a nutrition course on our Choose Health website, as well as a keto and intermittent fasting course done by two of our doctors. One was done by Dr. Madrid and one was done by the wife of one of our doctors. And so if you're interested in learning more about those two things that go hand in hand, it sounds like with diabetes,
absolutely,
you're more than welcome to go on Choose Health and learn about those. Those are our free courses. But aside from that, if you are looking for another primary care provider, Dr. Rahman is wonderful. She is currently seeing patients at our McKenna location. So give us a call if you're looking to learn more about diabetes or if that's something that you're interested in. Dr. Rahman can help you out. So thank you so much for being with us today.
You're so welcome.